Hello, I am Nurse Practitioner Abby here at Integrative Medical at Rockford, here with another Integrative Chat. Today, I would like to chat with you about something called small intestinal bacterial overgrowth. I don't know if you can see that. SIBO. It's often called SIBO, or sometimes you might hear it called SIBO. And it's exactly what it says. It's when your small intestines have an overgrowth of bacteria. It's not always bad bacteria. It's bacteria that probably should be there, but the amount has increased. Just a little bit of an anatomy to begin with. So this is a human body, and right here you have your small intestines, and then around it you have the large one. So right now we are talking about this area here. How would you know if you possibly have small intestinal bacterial overgrowth? One of the main symptoms would be gas and bloating, and particularly after you eat certain foods. Some people might think it's an intolerance to foods like lactose intolerance, but sometimes it's actually an overgrowth of bacteria in the small intestines. Bloating, gas, constipation mixed with diarrhea, some of the same symptoms that you have with Crohn's, but it's not. It's actually this SIBO. Also, you notice that you have these when you eat foods high in fiber. So some patients would say, I'm constipated all the time, and so I've been eating a whole lot of fiber. Then we find that these bacteria actually like fiber. So fiber would actually make the constipation worse. How would you get SIBO? Most patients don't really know how it comes about, but here are some ways that SIBO may occur. If you've had any kind of abdominal surgery and the anatomy has changed a little bit, then you can develop this bacterial overgrowth. If you're someone who's been on PPIs or medications to help decrease stomach acid, that can cause it as well. If there's a motility problem where food is not passing at the correct rate down that digestive tract, that can also cause this small intestinal bacterial overgrowth. If there's scarring in there, if there's celiac disease, or even if you have Crohn's disease, you can also have this. It's diagnosed one of two ways. There can be a blood test or a breath test. In this office, I like to use the breath test. You take a substance called lactulose, and it produces a sugar that the bacteria like, and then you breathe into a tube and it collects your air. And from that, we can determine what type of bacteria is growing because, as always, if you know what's there, you know how to treat it. Some of the treatments really are pretty much the same. You have antibiotics because you really need to kill the bacterial overgrowth. You can't just not feed it, you have to kill it. So there is commercial antibiotics that you can use prescription that actually works really well for one particular type of bacteria. But I like to try also, you can combine them or you can just use more natural supplements. And some of these supplements would contain things such as garlic or oregano or olive leaf. They're really good to kill this. And mostly it's done in combination. It's not really one or the other. You want to combine different herbal supplements in order to kill it. Another thing that you want to do is change your diet because these bacteria really, really love fiber and they love sugar. So consider a FODMAP diet. And that is a diet that's really low in the fiber and low in the sugar in order to kill the bacteria. It usually takes about a month to treat SIBO if you use a prescriptive antibiotic, usually about 3 months if you want to go the natural way. We always want to consider, though, what caused it. So if it was an anatomy problem, maybe there was surgery that was done at their scar tissue, some of that may not be able to be removed. So the treatment plan may be a little bit longer term. If it's a motility problem, we want to go through and give you things to help with your motility. The good news is SIBO, small intestinal bacterial overgrowth, can be diagnosed, it can be treated, not just the symptoms, but getting to the root cause. I am Nurse Practitioner Abby. This has been another integrative chat. If you have any questions about small intestinal bacterial overgrowth, give me a call at the office at 779-423-2044. Thank you for joining me for another integrative chat. I will see you at our next chat, or better yet, in the office. Have an amazing day.